Ikarus or IKZF gene is located on chromosome 7p, and deletions of this gene have been associated with a poor outcome for many years now. Initially, it was discovered by Charles Mulligan et al. And published in the New England Journal of Medicine that these deletions were associated with a very poor outcome. There's been a wealth of literature since then, and we now have a kind of slightly better handle on exactly what's going on. We know that in pediatric ALL overall, around 15% of patients will have an Ikarus deletion, or an Ikarus abnormality rather, and the vast majority of these abnormalities will in fact be deletions. You can occasionally get gene fusions and also mutations. Overall, it's well established that these patients, if you just do a simple comparison of patients with and without Ikarus abnormality, those with an abnormality do worse than those without. However, it is a secondary abnormality, so you always have to take into account what the primary abnormality is. And when you look at it in more detail, you find that the presence of the Ikarus deletion is closely related to the type of the primary abnormality. So you will see a much higher incidence of Ikarus deletions in patients with BCR-ABL positive disease, and a much lower incidence in, say, patients with ETV6-RUNX1. And of course, patients with ETV6-RUNX1 have a much better outcome than those with BCR-ABL. So really, in order to refine and look more deeply at the effect of Ikarus, people have started to do more precise studies into the prognostic effect. And I think the clearest indication that we've had is that you need to take into account not just the primary abnormality, but also what other copy number alterations are going on. The German group, the BFM study group, identified what they call an Ikarus plus profile, which is the presence of an Ikarus deletion in conjunction with either a CDKN2A deletion, a PAX5 deletion, or a PAR1 deletion. And they found that this was quite a small group of patients, much lower than the overall 15%, but they had a very poor outcome if the patient also had high levels of MRD at the end of induction. So combining the high level of MRD with a specific Ikarus deletion profile identified a group of patients that were clearly high risk and deserved to be treated on high risk therapy. Interestingly, we and others have identified a group of patients that have an ERG deletion, and the combination of an ERG deletion and an Ikarus deletion seems to kind of ameliorate the poor outcome of Ikarus deletion. So these group of patients don't have such a poor outcome. So overall, the answer to the question is it still a poor prognostic marker? Is yes, but it is a little bit more nuanced than that. You do have to take into account the other genetic context and also the level of MRD, typically at the end of induction. I'd also just like to point out that there is ongoing research to look at the prognostic effect of Ikarus deletions in patients with Down syndrome and acute lymphoblastic leukemia. And here again, the effect of the Ikarus deletion does seem to be particularly marked and associated with a poor outcome. So that concludes what we currently know about Ikarus